The way to think about it, with medical literature, it used to be new books came out every 5 years. Now new books could come out every 30 days. And with AI, they could take and review the world's studies on X and boom, say 99.9% of these are never going to work. Here's the 0.1% that'll work. If you eliminated alcohol, tobacco, and you improve nutritional status, you could eliminate 80% of hospitalizations. Coronary disease, cancer disease would drop off the map if all you did prospectively for the next generation is manage nutrition.
What do you think the biggest mistake that patients make when it comes to managing their own health care?
Self-advocacy, asking questions.
Welcome everyone. I'm Rachel Nash, a board-certified patient advocate, and I am thrilled to have you join us in our discussion today. I have the pleasure of interviewing Dr. Richard Zollinger, a highly respected retired physician whose career has spanned cardiothoracic surgery, wound care, clinical trials, and now physician coaching. Today we are going to explore how medicine has evolved, the challenges in healthcare today, and the critical role of patient advocacy. Dr. Zollinger, thank you for being here today.
Oh, I'm happy to be here, Rachel.
Can you share a little bit about your background in medicine and what led you to become a doctor?
Well, I became a doctor. I became a surgeon specifically because I was the last of 5 kids and my dad was a surgeon and 3 of my uncles were surgeons, and even my first cousin, one of the uncle's sons, was a surgeon. So I just thought you grew up and that's what you did. And the only other thing I entertained was professional golf. And when I got to be about 20, my dad said, you got to make a choice here. Which you think? I said, well, I'm pretty good in golf, but I'm not good enough. So that's when I took off on the medical career.
So you practiced cardiothoracic surgery for 20 years.
Right.
What drew you to that specialty?
I always loved the heart. I don't know. I wanted to do babies. I wanted to do kids. And it was a lot of fun. And when I was a general surgery, when I was almost done, my chairman said, well, why do you want to be a heart surgeon? All they do is 2 operations, meaning they do coronary bypass and heart valves. And I wanted to do baby hearts, which was more complicated and kind of more exciting when you're coming through and learning about embryology and stuff. And long story short, I had a child born with complications and stuff. And so it would have been another year of training. And so I got on with my life because we kind of had to. So that's how I ended up in adult cardiac surgery as opposed to baby surgery.
Okay. So after surgery, you transitioned into wound care and hyperbaric medicine. What inspired your shift?
Well, there's 2 things there that will be interesting because it'll come into effect. I'm the first example of what you call burnout, probably, when you look back on it in retrospect, because at the time, medicine was transitioning, practices were being bought, hospitals were coming into control, and private practice was definitely changing. So the hospital systems in this area got bought out, and our practice was one of the competitors that kind of got broken apart and picked off. So as it was, I said, okay, I'll retire. If my father had been alive, he would have shot me because I was 56. But he wasn't. So anyways, I took some time off. And then after about 4 or 5 months, I could have gone back. My brain was rested, like a sabbatical. Mm-hmm. And an administrator came to me who was a smart guy and really liked me and said, you know, we're going to start this new thing called wound care. Do you want to help start it and set it up? You'll have to get educated and do some stuff. And I said, oh, sure. And this was like 2007, 6, 7. So I went off and took classes and on hyperbaric medicine and wound care, management of wounds. I didn't even know what it was. And we set up the first clinic over in Charlotte off Abbey Road, and now they're everywhere. It's exploded. So, and then because of my background in vascular surgery, the man who ran this wound care company got me to come to Texas every month and teach on blood vessels and how they affected wounds.
Oh, wow.
So I got involved with teaching. And so I really had fun for about 7 or 8 years. And then I kept doing it. And then towards the end of that, my second retirement, it started to change with the hospital's management and stuff. So I stopped doing that. I was in my 60s. And then got contacted by a nurse MBA out of Ohio that was starting coaching, and a friend of mine was doing it. So I went and took another class online about how to be a coach and got involved with that. So that's that whole transition.
You've also been involved with clinical research, and you talked a little bit about medical consulting. What aspects of these roles do you find most impactful?
Well, I was kind of like a silent investor with a management company, so I can't say that I had great expertise in clinical management of those. And the whole idea was to expedite kind of what you saw happen with the COVID vaccines, how rapidly that happened. Mm-hmm. Well, before that, it would take 6 to 10 years to develop any kind of major medication, clear FDA and all that. And then in the span of 12 months, they cleared all those vaccines. So what I had become involved, we were trying to expedite drugs to market. And then his company kind of got bought up and went away, and now that's kind of with AI and everything, that's going to be the norm anyways. They're going to be able to bring medicines to trial to the community much quicker, devices, whatever it be. So that was my experience.
Do you think that's a good thing?
Oh, yeah.
A good thing?
Oh, yeah. Yeah, I mean, with AI, they can take... The way to think about it, with medical literature, it used to be new books came out every 5 years. Now new books could come out every 30 days.
Wow.
And with AI, they could take and review the world's studies on X and boom, say 99.9% of these are never going to work. Here's the 0.1% that'll work, and they can do it. That'll come very quickly, at least in my view.
Right.
So that'll be good for you and me as patients. Oh, yeah.
Yeah.
For sure.
Yeah. So as your role as a physician coach, mentor, what do you enjoy most about that?
People. It kind of brought some sad... I was a good person to start that because like I said, I was the beginning of the tsunami of burnout. But I would say that what's tough now is that you sadly see all these kids come through that are 35, 40, and they're already looking at the end of their training. They get out for a year or two, and they're going, okay, I want to do something else. What can I do? And they want you to tell them what to do, whereas coaching is you open-endedly let them come to their own solutions. You kind of, you're a what do you call it? Not an expediter.
Guiding them?
Yeah, well, not
giving them options?
Yeah, well, you don't even do that. You say, well, Rachel, what do you see in your future? And you let them come to their idea of what that might be. But it's sad to see them. Here's an example. There was something in the last 6 months to a year that, and I don't want to get this wrong, but like 50-60% of the Harvard graduates don't go into clinical medicine of Harvard Medical School. They go into business of medicine, be that drug companies, research, whatever. So that's kind of a sad statement to say you take 100 people and only 40 of them are going to go be there for you and me.
Right.
So that's a big change in the next 10 years, 20 years that you're going to see the workforce of medicine dramatically change. So.
Yeah, it seems as if, I think we've talked about this, doctors are being squeezed
Right,
out
right.
of, you have these...
Well, you know for a fact now, if you call and want to get in to see a physician's office, you're better off saying, I'll take an appointment with the PA, because you'll get in right away, whereas if you try to get the physician, it'll be 3 months.
Right, right. I last heard to get in with a psychiatrist, you're about 8 months away.
Oh, probably.
Yeah.
Because the numbers of psychiatrists are few.
Right.
So, yeah.
So you've witnessed decades of evolution in medicine. How has patient care changed since you first started practicing?
Less personal, more mechanical, EMS. I mean, I tell people in business, what COVID did to everybody is everybody became Zoomers, and everybody worked from home and worked from somewhere remote. And what you lost is the human touch. Mm-hmm. And if I want to sell you a product, all I got to do is meet you one time, shake your hand. Then you can sell me your widget from Singapore because I know you.
Right.
Well, medical care doesn't lend itself to remoteness. Yes, telemedicine is a good thing
Yeah.
for certain stuff. But you need the human touch, and I think we've lost that. And you've heard me say I call it the doorknob doctor.
Can you explain that a little bit more?
Well, the doorknob doctor is the guy, and this was from my father, and I wrote a little blog about it, but the doorknob doctors, we all have been there. The guy comes in the white coat, stands by the door, talks to you. He might be there 10 minutes, and you feel like he's rushed and he's busy and he's got to go. And my father made the point that when you make rounds as a physician in a hospital, you always sit down on the bed and always touch the patient, go, how are you? And you can be there 60 seconds with that patient, and the doorknob doctor's been there 10 minutes, and when the family says, well, Rachel, did Dr. Zollinger, oh, he came in, he sat down, and we talked. I was there a minute. What about Dr. John? Oh, he's busy. I didn't get to ask him my questions because he was very busy, and he was there longer than I was. So human contact means everything, and I think we're losing that.
Do you think doctors face more challenges in patient care than in the past?
Yes. I mean, I think what is killing the doctor, we all went into medicine because we like to help people. They're empathetic, sympathetic, whatever. They like to help. And now they're so involved with the business side, be it the EMR, the insurance companies, the hospital administration,
Right.
And then you throw in your own family and your own whatever, and it becomes very difficult to practice comfortably, and it's tough, I think, now, that's why you've seen a burgeoning of practices like, say, dermatology, maybe ophthalmology, practices where you're office-based, you have some control of what you do and this and that. But the subspecialties like I did, they're having a hard time attracting the brightest and the best necessarily because nobody wants to go through all that training to do that, and then it's just a different era.
Have you noticed a decline in patient trust towards healthcare providers? And if so, what do you think has contributed to that?
Well, I think yes. That's not 100% question because I think there's so much information now. So you all know it. I mean, we all know. We get on. We can Google this, Google that. Go to Mayo. What I tell people, for example, is if you really want to get on those sites and you want information, go to MayoClinic.com. Cleveland Clinic.
That's so helpful, though.
Yeah.
That's so helpful.
Go to those, Cleveland Clinic, Mayo Clinic, MD Anderson for cancer, Sloan Kettering for cancer. And there are a lot of great medical centers, don't get me wrong, but those are probably a good source of information if you want all that. But there's just so much overwhelming for the patients, but they do know more. It's available to them. It's on the news. Every newscast has 60-second doctor talks about ear infections in children or whatever it be. So yeah, they're a lot more knowledgeable, and that leads to kind of your advocacy ideas because knowing that they have to be willing to speak up for themselves.
True. There's a lot of misinformation out there as well, and there's a lot of, you may have pharmaceutical companies that are trying to sell you something, and you may not be aware of it when you're looking at, different diagnoses or different things as well. But I like how you refer people to Cleveland Clinic or Mayo Clinic, because those are the sites that you feel are going to help people
absolutely.
The most.
And don't get me going about advertising and drug-related stuff.
I want to get you going about that.
I've thought that was just wrong. First of all, the amount of money. The reason the drug companies will, in my opinion, advertise to such a degree is they want to show you that we're spending this money on research to save you from X. You'll see the ads. Take this and you'll live 3 months longer with X cancer or whatever. And the reality is, do you go into your doctor and say, well, I want that chemotherapy drug I saw on television? Well, the answer is no, you don't.
Right.
You go into Dr. Zollinger and say, what are we doing? And I recommend, and if you have faith in that person, remember, it's always the person you're dealing with, not the building. So if you trust the person you're dealing with, I don't care if he's in my garage. If I trust him, then he says, you're going to take this. I go, okay, that's me. So there's certain drugs I feel advertising's fine. Okay, stomach medicine or, things for diarrhea, whatever it is.
Right, right.
But to get in there and advertise, and if you watch the nightly news or any of those shows, you'll find out that about 80% of the advertising is drug related. Watch the next time, watch one of these shows and see how much is, and you go, why? I mean, I think I'd rather they spent that money on research and they don't have to tell me they're doing it.
Right.
That's just me, but.
So you've worked in both surgery and wound care. How has this approach to healing and recovery evolved over the years?
Oh, dramatically. Because two things. When I came through training in the 80s and 90s, or early practice, wound care was something, surgery, you close the wounds and then you had to get them healed. You could get infections and this and that. But dramatic wound care fell to plastic surgeons because they did burn care and skin grafts and this kind of thing. And what's evolved with, now you find out that there's a huge amount of the populace that lives with chronic wounds of their lower legs. Like, for example, I was watching the thing the other day. Henry VIII died of leg wounds. They had all the wives and whatever. But that's aside. But the deal is that the wound care, what made wound care fun and how it evolved is that anybody can practice wound care. In fact, you need them. You need family practice, ER, cardiac doctors, surgeons. Anybody can do it and it makes it fun because they all have a different insight into how things heal. They see them. They see your family doctor sees all the people in the office. So he says, well, And so what made wound care unique was you find Miss Jones comes in from church and says, well, they were putting pine tar on this wound and it healed. But I've had this wound for 22 years. So you say, well, you want to try pine tar? So you try pine tar and 50% of them heal. Now that's a crazy example, but it was a learning curve. What has dramatically changed with wound care now is nutrition.
Okay.
So when you hear like this last election, they were talking about food and all this stuff, nutrition, but nutrition is huge. If you think about it, and I think his name's Dr. William Lee from Harvard.
Okay.
You should listen to his podcast, but he talks about nutrition. If you eliminated, now this is never going to happen probably, but if you eliminated alcohol, tobacco,
okay,
and you improve nutritional status, you could eliminate 80% of hospitalizations. Coronary disease, cancer disease would drop off the map if all you did prospectively for the next generation is manage nutrition. Just nutrition. You don't need drugs. The problem with drugs and what made the drug companies so great is that's a knee-jerk. You're not acting proactively, you're acting retrospectively.
Okay.
It's like what I did for a living, coronary bypass. Well, you already have heart disease. So what I'm doing is treating the results of your disease rather than trying to prevent your disease. So nutrition's huge. If I had said to anybody nothing else in medicine going forward, I'd say work on nutrition.
Why do you think that we kind of lost sight of that? Something that would have been preventative versus being so reactive.
I think it's the way our society evolved. Okay. And I don't know if you go around the world, the societies are different. There's societies that don't have heart disease, or they don't have, as many strokes or depression and that. And, you'll go back and see pictures from the American population from the 70s and there was no obesity. So what changed that? Well, our lives got faster. We're on the go all the time. Fast food went through the roofs.
We're sedentary.
Do you want to biggie size that meal?
Yeah.
Instead of just this hamburger, now you get 2 hamburgers, twice as big, French fries, instead of this big, and we all get them.
Yeah. And it tastes good.
Yeah. So, yeah, they taste good, so, yeah.
So, as we know, many patients struggle to navigate the complexities of healthcare. What do you think, how can a professional advocate make a difference?
Oh, I think it can make a big difference. The problem for the patient now with advocacy is, in reality, if I was just sitting there talking to anybody off the corner of the street, I said, you have to be your own advocate. Family, somebody in the family has to be an advocate for sister, brother, child, whatever. And if you don't understand something or you don't believe it, then you have to ask.
Right.
And you can be a squeaky wheel and let them say, that's Mrs. Jones in 803 and her sister's an idiot, but you still have to go ask the questions.
Right.
And what a patient advocate will do for you, if that makes you totally uncomfortable, that's a person that can help you both from the family side and the hospital side, insurance side, try to orchestrate through those, Google map through that stuff, you know? And so I think it's going to be an extremely beneficial thing going forward, especially the way our healthcare system's going.
Right. We're a very new, patient advocacy is
Right.
is really a new field. We weren't needed, we really weren't needed, you know, many, many years ago. In your experience, were there situations where a patient advocate would have benefited, or a patient, I'm sorry, would have benefited from a patient advocate?
Sure. I mean, the difference in transition from when I was doing it to now is there wasn't all that information available to the patient. You know, they had to, that there is now. So some of that was what I said earlier. They had to have faith in what you said. You know, in other words, I said, well, we'll get medical social worker to work with you, or social services, or whatever it is, and you know, outpatient healthcare kind of things. And they had to take it at its given. Well, now there's so much information out there that what I told you, even a practicing physician can't keep up with it.
Right.
So if he can't keep up with it, how do you expect the... And the other thing is where the patient gets their information, like I said. They're getting so much information out there, and you all know, we watch the news and we don't know who to believe, which we don't believe anybody anymore.
Right.
So who do you trust?
Right. You know, I've even seen people asking questions on social media to other to their social media friends.
Yeah.
You know, and that always kind of scares me a little bit, because I'm a person that believes in evidence-based
Right.
research. So that's where I always go to read. I like reading studies, and I just think that seems to give, it gives me more information.
Oh, for sure. That's like everything Cochrane-based research or whatever. Yeah. So you can trust what you're reading. Yeah.
What do you think the biggest mistake that patients make when it comes to managing their own health care?
Self-advocacy, asking questions. And probably number one, don't be ashamed to call your doctor. Don't be afraid to call somebody. And if you can't get through, call somebody else or call the PA. But don't be afraid to go talk to somebody about your concerns. You know what you're feeling, and you just got to get somebody to listen to you. So I would say you got to be your own advocate in a way,
Right.
I guess. But don't be afraid to, you know, everybody says, well, I'm not doing that, especially men. We suck at it. So
What's one piece of advice that you would give to patients about advocating for themselves, and what would it be?
well, I would say understand that there's help available now. The professionals such as yourself that are there to help you. But also, just what I said there, just understand you have to start off with yourself, and it's okay to be an advocate and be a squeaky wheel. It's just, you have to be.
Right.
And it has to do, like somebody talks about insurance companies. Well, and we've had a lot with that over the last 6 months, you know, with the CEO of United Healthcare and stuff. And what I say there in your own deals is if you think you're in the right, or you know, you just have to keep appealing.
Right.
You just have to say, okay. And usually what I had to do as a physician is I just had to move up the line. Initially the nurses would do it, and then it'd get denied, and finally you just have to say, okay, get Dr. So-and-so from X on the line and I'll talk to him directly. And then when you do that, if you really feel strongly, you go, okay, fine, you don't do that, and that's, you just had to get almost in their face, and then you'd find, okay, we'll take care of that. And I think you'd find that out of the $100 that they deny, they know that 75 or 80 cents out of that dollar, those people aren't going to do that. So the 20% of the people who hang in there and fight for themselves
That's true.
get paid.
That's true.
So that's
That's
part
true.
of their business operandi, modus operandi, whatever.
So when you were practicing, you were able to do that. Do you think, I was reading a book and it talks about how physicians are now practicing with one hand behind their back because of all of the time restraints, because of insurance, because of the push to make sure it's done a certain way, and the focus is on coding. Do you think they have the time, if someone's seeing, 45 patients a day, to be able to do that?
Well, first of all, the reason for seeing 45 patients a day was they cut back the number of physicians. Then whoever owns the hospital wants you to see more patients, generate more income. You don't necessarily get paid more as a physician. They just make you work harder. It's, like the treadmill of the hamster on the treadmill. But what I would say about all of that, the EMR and all that, no, it just complicated things more and more and more. And you're spending more time on the business of medicine than direct patient care. And the example I gave earlier, I was talking to a young man, I said, well, when EMR came along, Epic, whatever, 25 years ago, I thought, oh, this is going to be great.
Right.
Because, I don't have to write all these notes. We just boom, 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 check the boxes and we're done. Well, what the reality of that over time was, I went back and medically, legally and reviewed charts back for a period of time. And what you would find is it was actually less insightful because everybody would auto-populate the last shift with the same information. Nothing had changed, so they just pushed da-da-da. And in the old days, your notes and stuff had some subjective and objective information in them. And I might say, well, Rachel's foot doesn't look good to me. We need to check back in 4 hours, 6 hours. That's just not as clear in the notes now. And somebody who's actively practicing right now may tell me, well, no, we've gotten better at that, and that may be the case. But that to me was, you spend so much time. It's like how many people tell you, well, I visited the doctor, but I saw his back pretty much the whole time because he was at the computer going like this.
Do you think patients today are more informed about healthcare options than in the past?
Yes and no.
Okay.
I think they are. I mean, for the reasons we said, there's so much information. An educated patient can get a lot of information, but think about all the ups and downs of things that were thrown at us during COVID.
Right.
And we didn't that. And I'll give you an example as a physician. Prior to COVID, I would take medical literature and the things I read. I knew what to say. Oh, okay, that's kind of little, but that was my own thing. But 90% of it was sacrosanct. I believed it. After COVID, I trust my medical literature as much as you trust the evening news.
Oh, wow.
I mean, you really have
Wow.
to know what journal, what information, who you're reading, and whether you think it's been auto-generated by AI or what. It's just changed, and it's no different than the rest of us feel about everything. So I think yes, the patient has more information and they're better informed, but at the same time, they feel their access is limited, because how often have you picked up the phone, called the doctor's? If you're sick, if it's really important to you, it's like your call is important to us, then call 911 and go to the hospital. So it's a way to field the call. So the emergency rooms have become. That's why you've had urgent care spring up.
Absolutely.
That was to defuse the emergency rooms, because everybody go in there with a cold, the flu, the what. And if you go to the emergency room now, half the rooms are called hallways.
I
You
see
sit
it.
in a hallway,
Absolutely,
and they can sit
yeah.
in a hallway for 2 or 3 days. You know, it's not fun.
Right.
Yeah.
Yeah, I see that. I see people in hallways.
Yep.
And often people are told by their doctors to go to the ER instead, and then, you know, it exposes them further to other
Well,
issues, correct?
Yeah. Well, 15 years ago, I told people the best way you could get in the hospital rather than go through the ER is know somebody that had my background, or a neurosurgeon or orthopedic surgeon, and I could get you admitted for your appendicitis and then say, call general surgery. So I'd direct admit you to the floor and avoid the ER, order the labs, and then call Joe Smith to be the general surgeon. He would take over your care. So that was a way to buy it. Well, you can't do that anymore. That worked for a little while.
So that can't be
But that's
done.
20 years ago, but yeah.
Have you ever had a case where insurance denied a necessary treatment, and how'd you handle it?
Yes, and what I just said earlier, you just have to, if you just would be vehemently go and fight them.
Okay.
So you go through the process of, okay, get me up the chain of command, who I got to talk to and who I've got to clear. And I'd say, I mean, there would be a patient where I'd have something that I had to do from what I did, and I'd say, that's fine. So we can have them call you when they die, when they expire. I mean, it would get that, literally that kind of conversation. Oh, well, okay, yeah, sure, you can go ahead and do this, whatever. Now, I don't know how is now, but that's kind of how you had it. But that wasn't that common.
Common, right,
No.
right. But it would be a horrible feeling for right now for a doctor that, you know, doctors become doctors because they care.
Right.
They want to help people. And if they don't have the time to be able to do that, I've seen on social media, I've seen a lot of doctors come forward with their frustration with insurance, and they're sharing stories. I love those stories. But I would guess that, you know, that would be heartbreaking to go home and not have the time to be able to make that happen for someone.
Yeah, well, for what I used to do, if I had it to do over again, and you backed up the truck and I put the time machine and went back, for what my specialty was, I'd only practice in a university medical center. Because in an academic center, I'd know what my time off was, I'd know what my salary was. I would have young people all the time training who were excited. So you were always dealing with the youth, like being a college basketball coach or something, and how that's changing now. But you were always dealing with 18-year-olds. When you get to be 50, 60, 70, that's kind of fun. So that part, and you would always have the best equipment at most places. You know, if you go to Wake Forest or Duke or North Carolina or East Carolina or South Carolina, they've got state-of-the-art stuff. So it just would be fun. There's politics in it. Then you've got politics, you know, which you have everywhere. But that's how I would change what I did. Now that doesn't follow for other specialties, but it would for what I did.
So as a mentor, physician coach, what do you think the biggest struggles are that other doctors face today? What are the biggest struggles?
Well, I mean, we all talk about burnout and you know, exposure to, with burnout comes you know, alcohol, drugs, everything that goes with anybody else with burnout. A distinct unhappiness, you know, stress, unhappy, and then that waters down into family. You're not there. Like people say, well, your family, you made a good living. I said, well, my family lived great, but I didn't.
Right.
I mean, in terms of quality of life and stress, and you can't know the number of nights you would go home and have some disaster, and you go home, depending on, never went to bed without sitting down in the living room in the dark and going, okay, what would I have done different, or what could I have done better, and the next time I'll do it better. And so the amount of stress that the young physicians feel now is, and that's just from the practice of medicine. The stress from the business side and the insurance and the administrators and all that is, it's overwhelming. And so I think one of the resolutions to that for these young folks is through coaching, but also through, I think, and maybe they do this in business, they should have sabbaticals.
Yeah.
So I think, and I don't mean go do health care in Guatemala. I mean go paint.
Right.
Go learn how to play a piano for 6 months. Maybe it's 3 months. Because when I first stopped, after 3 months, I was kind of decompressed and ready to go back, but I'd burned some bridges. Well, nowadays I would just say you need to work that into taking care of these young physicians.
Right.
You need to have that. There needs to be more physical support in the workplace, and maybe there is. I don't know now because I'm not there.
Right. It just seems like we can't lose any more physicians. When you said sabbatical, I was thinking we need all the physicians, but I understand. And it sounds like they're having burnout at an earlier age. I mean, you were talking about 35, 36, and they're already experiencing
burnout. Well,
burnout.
The other transition, understand the workforce. So 60% of your medical class now entering freshman year of medical school are female. So when you take that into account, they don't tend to go into, they want to have families and that, so they'll go into specialties. Some emergency room where you have known time, dermatology. In other words, it changes the dynamics of what the specialties are.
Right.
And that probably comes because if you've ever had a daughter, they tend to be more mature and ahead of the curve on education than males, and so they're the appropriate candidates.
What inspired you to join MD Coaches and work with other physicians on professional development?
Well, the deal there was a guy that I taught wound care with, and he was a general surgeon in Alabama, and he retired from wound care. He got frustrated, and he burned out from wound care. So there was a lady who was a nurse, MBA, who had worked for the wound care company, who then started her own company out of Ohio, which is actually from my hometown, Columbus. And first hire was him, and they started a podcast.
Mm.
And so he said, well, you need to come do this. What are you doing? I said, well, sure, okay. Well, you got to go online, take a course over the course of a year, and for this. And I did, and it was like career number 3. It was just like a fun thing to do. And then she made me write a blog every week and things like that. And face to face, these people are in Florida, Alabama, Idaho, Arizona. I haven't met but one of them face to face.
Wow.
It's all Zoom, but it's as if they were
right there.
Right there, yeah. So it's very supportive and a lot of fun.
So you're the co-host of Picking
and Putting.
Okay, thanks for saying a podcast. Can you share a little bit about the show and what you enjoy about podcasting?
Yeah, Picking and Putting's kind of fallen by the wayside a little bit now over the last 6 months because I started doing it with my son-in-law.
Okay.
But it started out that I did it. The reason it was called Picking and Putting was it was golf stories, and the buddy, my best friend, was a musical guy, so he'd bring a musical story. His father had written a famous musical song, and so he had a lot of background in music. So he'd bring a musical story, and I'd bring a golf story, and then we'd start talking. Then after a while, he says, "Well, we're not going to be world famous doing this," and he's all about let's go. So he said, "Well, I'm not going to do it anymore." So I did it with my son-in-law, who's a big sports nut, and so it evolved into we'd get together and talk sports.
Okay.
And now there are 1,000 of those shows, so I don't know. We had fun doing it. I don't know that, and we did it on Zoom, and and had a simple host called Buzzsprout and stuff. But it wasn't fancy, but I was doing it for me and him. It was entertainment, and if anybody watched it, great. It was always fun to see.
Can I find it? Is there a way to find it? Is it on YouTube?
Yeah, I had it posted. It was on YouTube because we did it with Zoom with pictures, so. We had it on. Yeah, I had it on all the platforms.
Okay.
Apple and YouTube, and now you're going to go back. But it was always fun to see where people in Europe were watching it. I'm going, you kidding me? You know, every week you'd see 2 people in France. You go, okay,
That's
whatever.
interesting.
Well, they were probably golf nuts. So
Now here's my favorite segment. This is my favorite part. These are closing fun questions.
Okay.
You probably saw this. So coffee or tea?
coffee,
Okay. If you could instantly master one skill, what would it be?
play the piano.
Oh, wow. If you had to eat one meal for the rest of your life, what would that be?
No question, pizza.
Okay. Oh, that's a good one. What's the most interesting place you've traveled to?
Prague.
If you could time travel, would you go back to the past or would you go ahead to the
I go
future?
future.
Would you really? Oh, wow. Why? Why?
Well, I'd like to see the technology side.
Okay.
I'm excited about how all this stuff is going to affect medicine because I've always been called a visionary, but I didn't get anything done. But I could see things, and I tell people I just fully believe the great frontier of medicine is the brain. So right now, my neurosurgery friends would fault me for this, but we ought to be able to, manage strokes, obesity, schizophrenia. We don't understand any of that stuff. And I fully feel that in the future, we're going to see things very quickly like ALS, multiple sclerosis, cured. Just they turn off the gene or they do
exciting.
whatever.
That's
And
exciting.
that's what I want to see. Do I want to see the geopolitical world stuff? No.
I agree. I
No.
agree. But that is exciting,
Yeah.
though. What's your favorite way to relax after a long day?
Oh, I watch sports on TV.
Do you have a favorite quote or a motto that you live by?
Yeah, well, it worked when I was practicing, and it was from my father's mouth, and it was, if you want to have patience, be patient.
I like that.
And if you talk to anybody who knows me, I'm still working on the patient side.
Say that again. Could you repeat that?
If you want to have patience with a T,
Okay.
clients,
Right.
you must be patient.
That's good. I like that. I'm going to take it.
Yeah, that's a good
I'm
one.
gonna use that too.
Yeah, I like it.
If you had any superpower, what would it be?
Fly. I don't know why. I like Superman. What the heck?
What's your guilty pleasure TV show or movie?
Oh my God. Well, movies. I like all those sports movies, like The Natural, and now they've been talking about Hoosiers because of the recent passing. But I like all the sports movies. But they've made it. I'm totally addicted to everything BritBox.
Okay.
All these mystery shows, and you can binge watch them. I love all those.
So if you could have dinner with any this is a good question, historical figure, who would it be?
Abraham Lincoln.
Okay. Why?
I just think he'd be a cool guy. I mean, I love to read history, and I can't imagine being in his position. And I just, we have the similar changes in the world now, I guess,
Right.
and stuff. But I just think he would have been a cool man coming from the country. He became the president. He was a lawyer. I just think he'd be a neat guy to sit down with.
If you could bring one thing back from the past, a trend, a product, a place, what would it be?
If I really thought about that, I'd bring back the 50s.
Okay.
I'm old enough, a lot of people listening wouldn't be, but back when you came home from school, my mom would give me a Coke and a ham sandwich and say, "I'll see you at 6," and throw you out the door. And you went out, and we had a creek behind our house, and we played at the creek. Childhood was just so different. So compared to today with the kids, where's your next event? Where's your next whatever?
What's one thing on your bucket list that you haven't done yet?
Well, I'm trying. I'm working on it, but I'm trying to become fluent in other languages. So I work on that every day. But probably take up. I would like to take up some other skill, like painting, or, music. Everybody always says that, but painting or sculpture or something. Probably not sculpture, but painting would be good.
Now here's a question I don't know. I was thinking, how is Dr. Zollinger going to answer this one? What is your go-to karaoke song?
Yeah, I don't have one.
I didn't think you did.
But we talked about this. I said it's got to be YMCA, September by Earth, Wind and Fire,
Okay.
or and I'm blanking on her name all of a sudden, Mariah Carey at Christmas time.
Okay.
Because when she comes on, I roll down the windows and start singing out the window the same, yeah.
Yeah.
I take off right away.
If you could be any animal as a pet, real or mythical, what would it be?
Oh, golly, I don't know. I love dogs. I'd be a Saint Bernard.
Yeah.
Yeah.
Okay.
Roam around the snow would be good.
Beach vacation or mountain retreat?
Beach.
Okay. What's one hobby you've always wanted to pick up but haven't yet? And I think you mentioned that, possibly.
Yeah, probably arts.
Arts, okay.
Yeah.
If you had a time machine for one day, where and when would you go?
I'd go back and talk to my dad.
Oh. What's the greatest compliment, the best compliment you've ever received?
That you're a good doctor.
Pancakes or waffles?
Pancakes.
Okay. What's a small daily habit that brings you joy?
Oh, I love getting up in the morning, first cup of coffee. I read 3 different newspapers and I practice 5 languages.
Wow.
I don't know any. I'm doing Czech. You want to do a hard language? And the only reason I did that was I had a friend. That's why I went to Prague, who lives there. Beyond, I want a beer and thank you. But it's no different than somebody who does a New York Times crossword. It's a way to stimulate your brain. I do it every day.
I like this last question. If you could give your younger self one piece of advice, what would it be?
Don't worry. And you've read that multiple times from people who live into their 90s. Don't worry because it doesn't change anything. Even though you're going to do it, because we just all do. And patience. Be patient and be a better listener. And that's what coaching is. Coaching is about listening. It was a very hard skill for me to learn because doing what I did was you came to me and I tell you what you need to do, and it was like, this is what you need to do.
Mm-hmm.
It was just different. And then you get older and you realize, I wish I had been more patient.
I follow you on LinkedIn, and I get that theme. I hear that when you like things and you share things, it does seem to have that theme of patience.
Yeah.
Dr. Zollinger, it's been a pleasure speaking with you today. Thank you for sharing your incredible journey, for surgery to mentorship, your insights into the evolving world of healthcare. I know our listeners have learned so much about the challenges patients face and why advocacy is more important than ever. Thank you for your time. And our audience, thank you for joining us. Stay informed, ask questions, and always advocate for yourselves and your loved ones. Thank you very much.
Oh, thank you for having me.
It's been a pleasure. Thank you.
Yeah, it was a lot of fun.
It's
I enjoyed
fun.
it.
Thank you.
Thanks.